Good afternoon. This is Robin Openshot. I am the Green Smoothie Girl, and I'm here very, very honored to be studying with Dr. Francisco Contreras at the OASIS of Hope in Tijuana, Mexico. And most of my readers are from North America, and so there's some stuff about Tijuana. I always thought of that as the place to go get free stuff and vanilla, right? But here I am in actually quite a lovely hospital behind a gate, and it's very clean here. It's very modern. They're doing some cutting edge things here. What's really interesting to me about OASIS of Hope, been absolutely fascinated with what I've been learning, is that you can do things that our FDA hasn't approved, which doesn't mean they're bad or they're crazy. It means that they might be approved in Russia, Japan, Canada, all of the above. Mm-hmm. They may be very, very effective, but they haven't gone through our very lengthy, expensive process. So, Dr. Contreras, one of the reasons I'm just absolutely enchanted that I get to be here is that you're carrying on the legacy of one of my heroes, your father, mm-hmm. Ernesto Contreras, yes. who was the very first integrative oncologist in the world. Mm-hmm. And he picked up on the work of Otto Warburg, which predated him 20 or 30 years that yes. no one was paying attention to, which won a Nobel Prize. And he put those things into play. You're now generation 2, which means that you can build on this incredible legacy. Will you tell us what makes OASIS of Hope's treatment special compared to what's happening, especially north of the border in the U.S.?
I think that what separates the OASIS of Hope from any other institution that's treating cancer around the world is not that we use alternatives, which we do very effectively. What separates us is that philosophically, we are not fighting tumors. We are helping patients. Rather than destroying tumors, we are providing resources to our patients for them to heal themselves. And we provide resources not only at the physical level with medications and treatments, we also provide resources at the emotional level and at the spiritual level, based on 2 principles. The first principle was stated by Hippocrates, the father of medicine, who said, first do no harm. So our first principle is that every therapy that we're going to use it as long as we are convinced that it's going to help improve the quality of life of our patients. And the second principle was stated by Jesus, and he said, love your neighbor as you love yourself. We say, love your patient as you love yourself. That means that every therapy that we're going to design is a therapy that we ourselves would be willing to use in case we would be troubled with cancer. And that is very rare. Most oncologists never take chemotherapy.
Yeah, there's a
Radiation
study.
therapy, yes. But
isn't there a study in the U.S. that most oncologists, when asked anonymously, say
exactly.
they would not take the treatment that they recommend to their patients?
86% said that they wouldn't take it. And the guy that did the polling concludes at the end that the other 14% were lying. So that's the philosophy, and that's really what separates us from anybody that's treating cancer with whatever modality.
And you are shrinking tumors. I saw some incredible slides that you showed in your presentation today to the patients and myself. They do shrink some tumors.
Yes,
sure.
Definitely. But that's not what's important to us, because there are many therapies that shrink the tumors, but then the patient dies. Yeah. For us, what's important is the patient is alive. In many cases, of course, we need to reduce tumor mass. That's very important for us and obviously for the survivability of our patients. But still, that is not our main aim. Our main goal is that the patient survives for a long time with quality of life.
Right. And you're doing 3 really interesting things, either to prep a patient to be really resilient to the side effects of chemo and radiation, yes. and to increase the efficacy of chemo and radiation. And those 3 things also have the power to oxygenate, kill tumors.
Correct.
And tell us what those are, because one of them is approved in Russia, but not here.
One of them is Prevtec, that's approved in Russia and Mexico, but not in the States.
The US.
The other one is Ozone, which is approved in Mexico, not completely banned in the state legally, but most doctors don't use it because there's a lot of pressure for them in doing that. And the other one is using very, very high dosages of vitamin C as chemotherapy, based on research by the NIH and the NCI, which proves that if you use 60 to 100 grams of vitamin C in a very short time, in the presence of oxygen within the tumor, it will act as chemotherapy without any of the side effects.
Very good. Well, I'm going to go undergo ozone therapy here at Oasis of Hope myself, so this gets really visual for you and see what happens. Thank you very much for having me at your clinic and for talking to my readers, many of whom have loved ones who are battling cancer.
Yes.
And we hope that there's some folks who are willing to cross the border and reach out for some hope here. So.
And there is a tremendous amount of hope. I think, the message is that cancer does not have to be a death sentence. You can change that.
I was telling Dr. Contreras that one of the things that surprised me most in this cancer journey that I'm only about 6 months into, in the various places I've visited, is that I thought that you would either cure cancer or die of cancer. And what I'm finding is that a lot of integrative practitioners understand that sometimes you coexist with cancer. My grandfather did it. I tell the story of my grandmother beating melanoma cancer with an all-raw diet. Well, what I don't often tell the story, just because it's a long story, is that her husband, my grandfather, also had cancer. And he had it for 35 years before it was diagnosed. And the MD actually said to him, "You've been living this long with cancer because of your fantastic diet." It wasn't a problem for him. It wasn't a big deal. I think a lot of us probably have tumors and don't know it, and so it's only a problem when we choose to let it own us. A lot of times, right? So I'm really grateful for the shift in my thinking, and I think a lot of cancer patients could start to think differently, address some spiritual healing that needs to take place, and some really amazing things can happen. So I'm off to interview someone who is a survivor of cancer, very deadly cancer, 37 years ago, here at Oasis of Hope, and he's healthy and 67 years old now. So we're going to go see him, and I'm going to go get that therapy. Thank you so much for being with us.
Thank you very much. God bless you.
See you next time.